You've heard of the term case acceptance or the phrase treatment presented versus accepted, but don't really know what it means. Or maybe you understand what it means, but haven't really figured out how to use it in your dental practice. Well, that's exactly what I want to talk to you about today in this video, because after doing things the same way for 5 years, once I learned how to use this information, I changed everything about how I was presenting treatment to patients. And because of this data, I started making small incremental changes that gave me enough of a boost to my bottom line. Enough to a point where I wanted to get more out of this data that's produced in our practice management systems every day. And we produce this data seeing every single patient every single day in our offices. And I wanted to use this data to ultimately help me make some important business decisions that would basically increase my profits without necessarily increasing expenses or overhead. And I'm making this video because there is one email that I received from a doctor who happens to watch our videos because he wants to start tracking accepted dollars or accepted treatment by his patients. He's got a manual process in place for tracking what he's presenting to patients, but doesn't really know how to start tracking the accepted dollars. And he's also wondering how he can use this information to ultimately improve his business. So as I was making an outline for this video, there was a lot that I wanted to go over. So I've decided to split this into 2 parts. For the first part, which is the video you're watching right now, is we're going to cover the why tracking what you're presenting to patients and what's getting accepted is even important and why does it even matter. And we're also going to cover how to get this data. All right. For the second part of the video, I'm going to focus on how to use all of this data to actually make changes in your practice that would add to the bottom line of your practice without increasing expenses or increasing overhead. All right, let's get started. So here's what we're going to cover in this video, which is part 1. So 1 is why tracking what you're presenting to patients and what's getting accepted is important, why it even matters. Second, we're going to cover how to actually get this data. I'm going to show you how we used to do it using a manual way, using Google Sheet. And we'll also cover the problems we ran into using this Google Sheet. And then finally, make sure you stick around to the end because I'm going to go over another solution that gives you all of this information at your fingertips in a matter of seconds without having to constantly rely on your team to make sure they're updating the Google Sheet to make sure the data is actually accurate. So we'll start with the why. If you don't understand the reason why you need to do this in the first place, it's going to be hard for you to put in the effort to put all the things in place that actually gives you this data. So why do you need to track case acceptance? Why do you need to measure what you're presenting to patients and what's actually getting accepted? Well, we spent multiple 6 figures on going through dental school, learning the basic biology and clinical skills to become a dentist. We then spend more money taking continuing education to learn more clinical skills so we can do advanced procedures on patients, whether it's sleep apnea, ortho, surgery, full arch implants, full mouth construction, etc. Some of these programs can cost upwards of $10,000 to $30,000. So after having spent so much money learning these new procedures, and then even more money on marketing for these procedures, there's absolutely no focus on the one thing that actually makes sure you get to do these procedures on patients. And that one thing is case presentation and everything else in your office that influences the patient's decision to move forward with treatment. And I am not just referring to how you present cases to patients. There are multiple factors that influence the patient's decision to move forward with treatment. Like, is your team given enough resources to present cases to patients to the best of their abilities? Are patients given options, not just treatment options, but from financial or maybe scheduling convenience? Case presentation isn't just limited to clinical aspects. It's not just the doctor's responsibility. Sure, it starts with the doctors and the hygienists because we're looking in the mouth first, but ultimately the whole team is involved. Have you changed how you present cases to patients? The way you present single tooth dentistry is going to be way different than how you present your big comprehensive cases. This is not going to be a video on how to present cases to patients. But have you looked at a log, maybe in the last 6 months, of how many crowns you've actually recommended to patients and how many actually didn't move forward? Why didn't they schedule? And I'm not saying that case presentation is only important when you're presenting big cases. Unless you're a niche practice where you're only doing veneers or you're only doing implants, presenting quadrant general dentistry is still the bread and butter in most GP offices. So how you present these cases along with your big ticket items like ortho implants becomes super critical to the bottom line of your practice. And after spending so much money on marketing to get these patients through the door, we kind of fail to continuously improve on our case presentation as a team in the practice. I know I did. I changed nothing about how I was presenting treatment to patients in the first 5 years of my practice. I was presenting the same way as I did my first day of associateship out of residency. I was just going through the motions, seeing one patient after another, presenting treatment, and on to the next patient. There was no room mentally to kind of zoom out and look at the bigger picture. Why aren't my patients moving forward with Invisalign? Isn't it enough that I tell the patient that they need a crown and just letting them decide and leaving it up to them to decide if they want to schedule? I was never trying to improve on just one thing. I never thought about just getting better at getting my big crown and bridge cases accepted. Honestly, because I just didn't know what I was supposed to be looking at. I was jumping from learning one new procedure to another, sort of like a shiny object syndrome, and not focusing on the one thing that I really needed to improve on. Once I took a closer look at what I was spending on marketing every month and realized how many patients actually were not moving forward with treatment, I realized that the only way to improve any aspect of case acceptance with patients was to actually start tracking. Imagine a whole week worth of patients you've seen and all the treatment you've recommended to all those patients throughout the week. Now consider the whole month. Now the whole year. Now multiply that by 5 to get 5 years. That's a lot of treatment that you've recommended to patients. Sometimes we get into a routine, but don't take a step back to look at a bigger picture of what's going on. So you're probably thinking, what the hell am I talking about? So let's say I'm looking at a 3-month time period of all the treatment that I've recommended to my patients. And I need a bigger picture to see what's going on as the owner of the practice. I need a way to objectively look at this data in a 3-month time period to help me make an important business decision on how I can approach case presentation in my practice. Once I know where I have to improve, even if my small change can result in a 10% improvement, that's 10% extra treatment that's scheduled without any increase in overhead. So I'm not increasing my overhead. I'm not spending more on marketing. I keep it the same as it was before. I have the same team, same resources as I did before, but now trying to introduce small incremental changes by looking at the data on how much I'm presenting to patients and what's actually getting accepted from what I present. So now looking at, for example, data over 3 months, here are some questions that I would have as the owner of the practice. How much net did we treatment plan in these 3 months? Now, I'm an insurance practice, so I don't care for gross numbers. I only care about net treatment plan dollar amounts. How many crowns did I treatment plan? If I've recently invested in learning sleep apnea and I'm trying to implement it in my practice, I'd want to know how many appliances have I treatment planned? How many sealants did my one hygienist treatment plan versus the other hygienist? Is my one hygienist better at bringing up whitening treatment and getting them scheduled compared to the other hygienist? Why is my one associate doing a lot more crown and bridge cases versus the other associate? The important point to also remember is that it doesn't go on your schedule unless something is diagnosed and treatment planned for your patients. But knowing the answers to these questions is only part of the equation. You'd also want to know what's actually getting accepted from all the treatment that you're presenting to patients. So 2 questions that usually come up when I say things like you need to be looking at data over a 3-month time period. Well, why 3 months? Well, I've picked 3 months because I feel it's the minimum amount of time that gives you just enough data to be able to make a decision from it. What good is looking at data and percentages if it can't help you accomplish something? If I've treatment planned a couple of extractions, bone grafting, and maybe single unit implants to replace those missing teeth, and maybe even a couple of crowns to replace those leaky amalgam restorations, realistically, most patients aren't going to schedule within the first week or 2, or maybe even 2 to 3 months. How soon a patient moves forward with treatment comes down to a few things. The procedures you plan on doing and the investment required. Simple restorative versus full arch implants. Patients may need to consider not just from a financial perspective, but also from temporary lifestyle changes required for a better permanent solution. Also, their schedule availability. Maybe you're waiting for extractions that happened in previous office. Now the patient's coming to see you treatment plan implants, which you're not going to be able to place in the next 3 months. And sometimes patient just wants to think about the treatment plan longer because they need more time to make a decision. Yes, sure, you can look at the data on a daily basis on how much you're presenting to the patient, but looking at the data on what's actually getting accepted in a week's time may not give you enough data to make a business decision from it. And sometimes the argument is, well, isn't 6 months better than 3 months? Well, sure, you'll definitely have more data with 6 months, but 3 months is also enough time for you to be able to make a decision to make any changes in your practice workflow if you need to. And plus, you don't have to wait 6 months. So the second question that comes up when I say things like, hey, you have to measure over a certain time period on how much you're presenting and what's actually getting accepted. So the question that comes up is, what does it mean when I say accepted? It means the procedure that you've actually treatment planned for a patient or presented to the patient is either scheduled and or completed in that same time period. So if we're looking at, let's say in a 3-month time period, the total net dollars you've presented to the patient or diagnosed or treatment plan for the patient, accepted would mean in that same time period of 3 months, for example, how much is actually either scheduled and or completed for that same time period. Of all the implant placements you treatment plan, how many did you actually place or schedule in the same time period? How many sealants is hygienist 1 treatment planning and completing in that time period versus hygienist 2? Is my one hygienist better at scheduling and completing more whitening treatment relative to what she's treatment planning compared to the other hygienist? Why is my one associate treatment planning a lot more crown and bridge work, yet the other associate is completing a lot more fixed work? Why is that? Do they need more training? Do they have the same resources? Does the doctor have enough time to be able to present the clinical importance of whatever they're recommending to the patient? Do the doctors have enough time chairside for intraoral scans or intraoral photos or provide visuals to the patient for better case acceptance? Is there a different treatment coordinator that is here for the associate who's completing a lot more of the crown and bridge work? Or is someone else presenting the case for the other associate? Where's the bottleneck? Unless you have a way to objectively look at this data, you're basically just going about your routines, spending more on marketing, hiring more admin team members because your patient base is increasing without actually realizing you're not even increasing the bottom line and you're only increasing overhead. You're not looking at the data that's being generated on a daily basis that's available to you at your fingertips. The data that you can use to make decisions based on actual facts. So I hope I've given you enough reason or two to start looking at this information in your practice. So let's talk about the how. How do you actually get this data so you know which direction you need to go to help you improve case acceptance in your office? Well, I'm going to show you how we used to do it, and then I'll also talk about how we do it today. We used to do it manually using Google Sheets. So let me show you how we used to do it with Google Sheets and how to actually get the data to input into the sheet. So here is the Google Sheet that we used to use to track treatment that we presented versus what was accepted. So let me first start out by going over what you're looking at. So when we created the Excel sheet, we would have a single, basically one Google Sheet would hold all the different sheets for the month. So January all the way to December in the current year. So whatever year you're in, you now would have different folders created for each year. The date column basically represents the day that you're in the office. So the first of the month, the second of the month, third, and the other, whatever, holidays or weekends, and the 6th, 7th, etc. Okay, those represent basically the days you're in the office. And for each day you're in the office, you're seeing different patients. Again, this sheet, I'm the only provider that I wanted to track. Even though I had a hygienist at that time, I was not tracking any treatment presented by the hygienist. I just wanted to start tracking what I was presenting. So I'm assuming all of these is provider for one single provider. If you have multiple providers, you would have this organized completely differently. You would have to list out the provider. Maybe you have a provider column or having a separate Excel sheet or separate Google sheet for individual providers. Anyway, so what you're looking at, so now under the patient column, these are basically not every single patient you see in the office, right? So if I have 10, let's say 9 patients here, these are not the only patients I saw that day. I'm only going to put on the sheet for patients that I recommended something or put something on to their treatment plan in Open Dental, right? Those are the only patients that go on here. So for example, John Doe came in and I presented treatment to him that was worth $1,884. That's what I put on the list. And this is what was scheduled because both of those procedures were scheduled. All right. So same thing for all the patients you see here. And the way we lay this out is at the end of day, basically, as we go about the day, we just keep inserting rows. So for each patient that we want to put on the list. And at the end of the day, we would just create a new row called a total total out the treatment plan total and the treatment accepted total, right? And this would get calculated automatically. And another day, let's say new day in the office in the morning, this is the office routine for the front desk. When she gets in, she would go ahead and basically start putting in the patients that as we go along, right? So hopefully that makes sense for you guys. And then what you're looking at is, see, right now I only put it up to 2 days. I just didn't want to create all the patients and on here just to, it would take forever to explain what I'm trying to show you guys. So basically, at this point, you imagine this sheet is completed and you're looking at the end of the month. So you would have first, second, third, and however many days you would have however many patients. This would go all the way down to maybe 150, 200, or depending on how many patients you see in a day. And at the bottom of the month, so the end of the month, I have this grand total which calculates all the totals for each of the days, right? And again, if you know how to use Excel or Google Sheet, I don't want to go into the details of how to do that, but you just hit the sum and select each of the days that you're in, and it would calculate that automatically for you. Same thing with treatment accepted. So that would show as of now, basically, let's say I've been in the office 2 days. As of now, that's the treatment plan total, and that's the treatment accepted total, and that's the acceptance percentage so far that we've only been in the office 2 days. Right? So I hope that makes sense. So now let's actually talk about how did we get this data here, which is the $1,884. What do you put into this amount of treatment plan for each individual patient? So let's start there. I'm going to switch to Open Dental and show you guys how to do that. So here we are in Open Dental, and let's say we're looking at the patient's treatment plan. For example, the first patient we said is John Doe, and we are looking at the treatment plan here. Okay, so whatever day you're in the office, let's say it happens to be May 13th, and what you would do is whatever the treatment plan procedures you treatment plan, usually the protocol is we would select those procedures. Let's say this patient is sitting in my chair. I'd go ahead and treatment plan for teeth number 9 and 10, surgical extractions. Well, I go ahead and select those procedure, right? And then hit save treatment plan. And when you do that, it creates this segment here with the date on it. So that date will be today's date, and that basically says those are the procedures you treatment plan on that certain date. Okay, that's the protocol we have in our office to kind of follow along on how everything is set up. Okay, so then if you notice the two columns, insurance estimate and patient portion, if you total up for all the procedures, that are 5 procedures on here, total up the 852 and the 539. If you total that up, that would equal basically the net insurance fee for all of these procedure, right? That's the insurance estimate and patient portion, which should equal the in-network fee if you're in network with this patient's insurance of all those procedures. So that's exactly what I would put as the total, 852 plus 539. That total is what I treatment planned basically, and that's what would go in the Excel sheet over here. Okay, so let's pretend that's 1884. All right, and now what happens is, how do you get what's in here? Meaning, how do you know what the patient accepted or scheduled or completed? Okay, the fastest way to do it is, let's say I presented this today, and patient goes ahead and schedules only 2 of the procedures. Usually, what I do in my office is I make a planned appointment for it. Okay, let's say it's only for tooth number 9. I put it to Pinboard. Okay, I'm going to go ahead and reschedule that appointment, and then I'm going to put it on the schedule. Let's just put it here. Okay, you notice for that procedure that's scheduled out of the total of whatever I treatment plan for that patient. So I treatment planned 5 procedures. Patient decided to move forward with only 2. Okay. In that appointment, I have Open Dental set up in a way that it shows you the net scheduled production attached to that appointment right there, 535. So the total of those 2 procedures is 535. So if I were to select, let's just say I move this out, right? I make it number 6 or something, just to show you guys what I mean. If you total up 277 and 257.40, that would equal the network fee for both of those procedures. So 535 is what got basically scheduled and or completed. It's not completed, so it's scheduled. So that's the total that would go under accepted treatment, meaning you treatment plan this much and patient only opted for a certain amount, and that's the total that would go in here. This is for a different patient, but I just wanted to show you guys an example of what would go in there. Okay, and you would do the same thing for each of the patients you saw. All right, so that's how this data gets filled in. Now, the problem with this is that you constantly someone has to be in charge of filling this in. Now, when we were in the office, this would be always open at 12 o'clock, meaning behind the patient. And while in the operatory, when I'm presenting, because I used to present all the treatment to the patients, I would just go ahead and update these numbers. And there are many times patient would go to the front to make the appointment. Then my front desk was responsible for putting in these numbers that, okay, out of the 8 fillings I treatment planned, and presented to the patient, she only scheduled for 2. So whatever that scheduled production was would get marked as treatment accepted. Well, now that I've shown you how we used to use the Google Sheet, let's actually talk about the problems that we had and why we stopped using it. The number one problem with using any form of Excel or Google Sheet is that you actually have to use it, meaning you have to consistently put data into it for it to reflect accuracy for what you're looking for. So every time you see a patient and you present something, or somebody else in your office presents something, or a patient schedules something, you have to actually input that information for the patient, the date, how much you presented, and what actually got scheduled if the patient scheduled that day. Now, you as the owner of the practice can do this yourself, ideally at the end of the day after you're done seeing patients for the day, or you may dedicate this job to somebody else on your team to maintain the accuracy of this Google Sheet. But now you have to rely on them and trust the fact that they're updating it every time either somebody presents something to the patient or patient schedules an appointment for something. But that presents another set of problems. Meaning, what if a patient calls back a month later after you saw them and schedule a procedure that you treatment planned a month ago? Is your team going back to the Google Sheet and updating the numbers to reflect the updated accepted numbers? What if a patient calls and cancels the appointment they have, which had a whole bunch of procedures attached to it? Are they going back to the Excel sheet and updating the numbers to reflect the accuracy? I think you get my point why maintaining the accuracy of data in this Google Sheet becomes super difficult, especially with all the things we have going on at the front desk. So naturally, we knew this wasn't working and we stopped using it. We stopped updating the Excel sheet. And of course, I stopped looking at it because I couldn't trust the accuracy of the data. All right, so now I've gone over how we used to do it manually. I've gone over the problems, why we stopped using it. So let me show you what we've replaced our Google Sheet with, which is Teamio's automated way of giving us all this information in a matter of seconds at our fingertips. And while I'm going over it with you, I'll try to address some of the questions that came up, like, hey, what if a patient cancels the appointment? And what if a patient schedules something a month after I've treatment planned something? What about updating the numbers and going back? Will the accepted dollar amounts be reflected correctly? Well, let me show you how it's done. This is the treatment presented versus accepted feature off of Teamio's analytics. When you first get to this screen, what you're seeing is the data for the current month, meaning from July 1st, from the first of the month to the current date, which is July 22nd. Instead of going over all the different things that you can do on the screen, I want to stick to the things that are specifically for the video that you're watching. Okay. And before I get into that, basically what you're looking at on this screen is for the current month and the current date, you're looking at all the treatment plan procedures, the scheduled procedures, as well as completed. All right, and the date is important here. This is only showing you any treatment plan dollar amounts and the treatment procedures, that there's a procedure count from July 1st to July 22nd. This is the date of the treatment plan that shows up in Open Dental. All right, and from what you treatment plan in those 2 dates, here's the exact thing that's scheduled as of today, the exact dollar amount, the procedures that are scheduled out of the 97 procedures treatment planned, and the completed dollar amounts. All right, now, one of the ways that a lot of their clients that are using us and who have moved on from other previous systems that they were using, one of the things they tell us that's good about our system is our dollar amounts are actually net dollar amounts, okay, which is important. I don't want to see gross dollar amounts, meaning your office fee when a patient has insurance. If I treatment plan a crown for MetLife and the MetLife fee is, let's say, $900, but your office fee is $1,500, I would like to see $900 included in this treatment plan total and not the $1,500. All right, I hope that makes sense. And that's super important when you're trying to calculate exactly how much you're treatment planning, what's getting scheduled, and what's getting completed. Okay. The other important aspect about this system, because we're so deeply integrated with only Open Dental, is the ability to filter by treatment priorities. So if you're on Open Dental and you look at your patient's treatment plan, there are certain priorities you can set up. if you treatment plan a crown or a denture or an implant, there are certain treatment options that are like alternative options, or you could mark certain items as wait or rejected for a procedure that the patient decided to reject instead of moving forward with it. Maybe they decided to reject the implant option and decided to move forward with the bridge option. Well, now what you can do here is you can actually filter that data out by either including or excluding. So if you're looking at a certain data range, let's just say we go back to March. All right, let's look at a bigger data range. So March 1st to now. Okay, I'm going to hit apply filters. It does a lot of data crunching in the background, so it takes some time. So again, from March 1st to the present date, we've treatment planned about $300,000 of net dollar amounts, 703 procedures total. I don't really care for the exact procedure count, but we leave it there because some of their doctors asked for it. And in the bottom, you're going to get a breakdown of different categories, like crown and bridge is exact dollar amounts, the majority of it is crown and bridge. Then there's fillings, the exact net dollar amount attached to how many fillings you've treatment planned from these date ranges from March 1st to the present date. Now, what I want to do, for example, 703, I don't want to include anything that's planned that you may have marked as rejected or wait, etc. So I'm just going to go ahead and say exclude. We're going to say wait. I don't want to include anything that is wait or rejected, okay? Even if I don't want to even include it in the treatment plan total. So let's just say apply filters. All right, now you see less procedures there. It filtered those out. All right, if you want to see exactly what it filtered out, you can actually say include only those two, and you can actually go there, apply filters, and it will show you the 8 procedural totals, about 11K, and you can actually click on the details, and these are the actual patients for whom that treatment plan is either marked as wait or rejected, and these are the exact procedures. Okay, obviously these are all unscheduled because you've either marked it as wait or rejected, and of course they're not scheduled appointments on the screen. I'm going to show you this by example because remember earlier in the video I mentioned that what if patient schedules a crown, for example, 2 months after you've treatment planned it? Do I have to go back to my Excel sheet and actually update it? What if you had an Excel sheet? Yes. But in this, we'll detect it and we'll attach everything automatically to the right treatment plan date. So before we get to that, I want to show you this example for this patient here, Rich Henke. He's got a treatment plan that is obviously marked as either wait or rejected on Open Dental. All right, so let's confirm that. I'm going to go switch to Open Dental. I'm already on his treatment plan, so let's go ahead and click on his treatment plan, and right here, his crown is marked as priority wait because he wants to wait on the crown, okay? Now, for example, without changing the priority, let's go back to this screen here, okay? I'm going to remove that. All right, and now I'm just going to say between those two dates, I'm looking at all the data. I actually want to just see the crowns. There's 2740, or I can type in crown, and you can actually filter by code. Now, this will show you how many crowns were treatment planned between those two dates. So we treatment planned about 57 crowns, of which 11 as of today are scheduled and 30 are already completed. Okay, now if I go in here, all right, and let's just say I sort it, you can immediately see Rich Henke, that crown is still not scheduled, so it's marking it as unscheduled. What if, so just remember this procedure count is 11. So as of today, scheduled count is 11 crowns. So if I go back to Open Dental, let's just say I mark this appointment as scheduled. All right, we scheduled the crown. I'm going to put it on Pinboard. Let's just say I put it on the schedule right here. Okay, now that crown scheduled number should be updated. So if I go back, and if I hit apply filters again, make sure your crown is selected here for the procedure code. All right, and that gets updated to 12 because now you have an additional crown that's scheduled. Okay, so I hope that makes sense. So it's pretty much, because it's deeply integrated with Open Dental, it's pretty much alive, and you can do this from any screen in the office or remotely even. Okay, any actions that's taken on Open Dental is pretty much live in sync with Teamio. What happens if the patient cancels the appointment, right? That's what I mentioned earlier in the video. If you're doing this manually on an Excel sheet, you'd have to, someone on your team or at the front desk, whoever, they have to go back to the Excel sheet and mark it as so it's not counting under treatment accepted dollars. So imagine 2740, you've got 12 crowns here that are scheduled. If I were to go back to Open Dental, let's say this patient decided to cancel the appointment, I can go ahead, let's say send to unscheduled list, but for now, I'm just gonna delete the appointment, okay? Patient decided to not move forward with it, we took it out, all right? And now if I switch back, that 12 should go back to 11. Okay, because it's no longer scheduled. All right, so that's how it reflects those numbers. You don't have to update it on Excel sheet. It automatically gives you all the information at your fingertips. Okay, and again, What if the patient schedules this a month after? Well, you're going to see that date, like I just showed you, when the patient scheduled, this count went up, all right? And it will be credited to the date it was treatment planned. Like, for example, if I go in here, let's just go here. Now that we deleted the appointment, it's back onto unscheduled status. It was treatment planned on June 5th. Okay, so that's how it works. So if the patient schedules a crown in August, they call in August, they schedule crown. Obviously, we look at it as June 5th treatment plan, and at the bottom, you're going to see those June numbers reflected correctly here. So for June, the treatment plan total, that 22,000 will go up by the fee of the crown. Okay, even though the patient's called in July or scheduled in August. Okay, we always track it by the month and the date it was treatment planned by. All right, so I hope that makes sense. There's a bunch of other things you can do on here. Of course, you can filter by the procedure code or even procedural type to see how many fillings you're treatment planning. For example, let's clear out the selection. And I'm going to, now I want to just see how many fillings I've treatment planned between March and now. And if I apply filters, these are the number of fillings. You've treatment planned about 147 fillings from that time frame. 27 as of today is unscheduled, and 94 of them are already completed. And of course, for fillings, you should have a higher percentage rate than anything else. All right, so far I've gone over why you need to track what you're presenting to patients and why it's also important to track what's getting accepted. All right, I've also shown you how to get this data manually, as well as Teamio's automated tool that now you're able to get all this data in a matter of seconds. For the next video, which will be the second video in this two-part series, I'm going to focus on how to actually use this data to help you make important business decisions that would actually add to your bottom line without increasing your overhead. So make sure to tune in. I appreciate you guys for tuning in today. And until next time, take care.